They just changed the rules, and millions of Americans have no idea. The Senate just passed the Elder Care Bill, and what's buried inside could completely reshape your Social Security checks, your Medicare benefits, and your retirement security, starting sooner than you think. We're talking potential benefit increases for seniors who've been shortchanged for years. We're talking new protections that could shield your loved ones from devastating care costs. And yes, we're talking about changes that could directly hit your wallet, whether you're already retired or still counting down the years. But here's what the headlines aren't telling you. Not everyone wins. Some beneficiaries could actually see adjustments that catch them completely off guard. Certain income thresholds are shifting. Eligibility rules are being rewritten right now. And if you don't know which side of that line you fall on, you could be leaving thousands of dollars on the table, or facing a surprise you never saw coming. This isn't political noise. This is your money, your parents' money, your future. I've broken down every section of this bill in plain English. No legal jargon, no confusion. So you know exactly what's changing, when it kicks in, and what you need to do today to protect yourself and your family. This is the most important financial news affecting seniors in over a decade, and you found it first. If you believe every American deserves to know their rights, smash that like button right now. Let's get this information to everyone who needs it. So let's get right into it, because what just happened in Washington is the kind of thing that affects tens of millions of Americans, and yet most people are only catching pieces of it through confusing headlines or 30-second news clips that leave out everything that actually matters. Today, we're going to fix that. We're going to walk through this elder care bill together, step by step, in plain language that anyone can understand. Because this is your money, your family's future, and you deserve the full picture. Now, before we dive into the specific changes, let me give you a little context, because understanding why this bill was passed is just as important as understanding what's in it. For years, honestly for decades, advocacy groups, senior organizations, and everyday Americans have been sounding the alarm about the state of elder care in this country. The costs of assisted living have skyrocketed. Home health aid services have become unaffordable for middle-class families. And Social Security benefits, while adjusted annually for inflation through what's called the Cost of Living Adjustment, or COLA, haven't kept pace with the real expenses that seniors face. Things like prescription medications, specialized medical equipment, and long-term care. The system was creaking under the pressure, and lawmakers on both sides of the aisle finally felt enough heat from their constituents to do something about it. That's what led to this bill. That's why it matters. And that's why you need to know exactly what's inside it. Let's start with Social Security, because that's what most people are immediately thinking about when they hear a bill like this has passed. The Elder Care Bill introduces a new formula adjustment for calculating Social Security benefits, specifically for Americans who are 70 years old and above. Now, this is significant because under the existing system, your Social Security benefit is calculated based on your 35 highest earning years, and once you've claimed, your increases are tied almost entirely to COLA. But what this bill does is introduce what legislators are calling an elder equity adjustment. Essentially, the Social Security Administration will now apply a supplemental calculation for those 70 and older that factors in what's being described as a longevity premium, a recognition that the longer you live, the more your fixed costs actually increase relative to inflation. In practical terms, this could mean an additional monthly payment ranging from roughly $50 to $200, depending on your benefit level and your age bracket. It's not a fortune, but over 12 months, that's between $600 and $2,400 in additional income for seniors who need every dollar they can get. But here's where it gets really important to pay attention. Because not everyone over 70 automatically qualifies for the full adjustment. There are income thresholds involved. If your total household income, meaning Social Security plus any pension, retirement account withdrawals, or investment income, exceeds a certain limit, the supplemental adjustment phases out. The threshold being discussed is approximately $85,000 for individuals and $120,000 for married couples filing jointly. If you're above that, you may receive a reduced adjustment or none at all. If you're below it, you're likely looking at the full benefit. So if you haven't recently reviewed your income picture with a financial advisor or your local Social Security office, now is absolutely the time to do that, because this adjustment could change your monthly reality in a very real way. Now let's talk about Medicare, because the changes here are arguably just as impactful. And in some ways, they've been even less covered in the media. One of the most frustrating things for seniors and their families has long been the gap between what Medicare covers and what it doesn't, particularly when it comes to long-term care. Traditional Medicare, as most of you probably know, does not cover custodial care. That means if your parent or your spouse needs help with daily activities like bathing, dressing, or eating, and they need that help in a nursing home or assisted living facility, Medicare generally isn't going to foot that bill. Medicaid can, but Medicaid is means-tested, meaning you typically have to spend down most of your assets before qualifying. And that leaves a devastating gap for middle-class families who worked their whole lives, saved responsibly, and still find themselves financially wiped out by a single health event. The Elder Care Bill takes a meaningful step toward closing that gap. It expands Medicare's coverage of home health aid services quite significantly. Under the new provisions, Medicare will now cover up to 40 hours per week of in-home aid services for qualifying seniors, up from the previous cap, which was far more restrictive and tied to strict skilled care requirements. To qualify, a senior must have a documented functional limitation in at least 2 activities of daily living. That's the ADL standard that care professionals use. And they must have a physician's order supporting the need for home care assistance. This is a massive expansion. For families who are currently scrambling to pay $25, $30, even $40 an hour for private home health aides out of pocket, this could represent a financial lifeline worth tens of thousands of dollars a year. And there's something else tucked into this section of the bill that I want to make sure you don't miss. The bill also creates a new Medicare benefit category called Caregiver Support Services. For the first time, Medicare will provide limited coverage for services that support family caregivers, not just the seniors themselves. This includes things like caregiver training, temporary respite care so that a family caregiver can take a break without leaving their loved one unattended, and access to care coordination services. If you are currently acting as an unpaid family caregiver for an aging parent or spouse, this is directly relevant to you. It's an acknowledgement from the federal government that family caregivers are a critical part of the elder care infrastructure, and they need support too. Now I want to shift into what's happening with Medicaid, because the changes here are a little more complex, and they vary more significantly depending on what state you live in. The Elder Care Bill includes provisions that expand federal matching funds for states that choose to broaden their Medicaid long-term care eligibility. In other words, the federal government is putting more money on the table and saying to states, if you expand who qualifies for Medicaid-funded long-term care services, we'll cover a larger share of the cost. This doesn't mean automatic expansion everywhere. States still have to opt in, similar to how the Affordable Care Act's Medicaid expansion worked. But for states that do opt in, the result could be significant. More seniors qualifying for nursing home coverage or home and community-based services without having to completely exhaust their life savings first. One of the specific Medicaid protections that advocates have been pushing for is also addressed in this bill, and it has to do with spousal impoverishment. Under previous rules, when one spouse enters a nursing home and applies for Medicaid, the couple's combined assets are assessed, and in many states, the spouse at home, called the community spouse, is only allowed to keep a limited amount before Medicaid kicks in. This has led to heartbreaking situations where healthy spouses in their 70s and 80s are left with barely enough money to maintain their homes and daily lives. The Elder Care Bill increases the protected resource amount for community spouses and adjusts it to better reflect today's economic reality. It's a protection that, frankly, should have been updated years ago, and it will make a real difference for married couples navigating this incredibly difficult situation. Let's also talk about prescription drug costs, because this is one area where seniors consistently say they feel the most financial pressure. And the Elder Care Bill has something to say about it. Building on previous drug pricing legislation, this bill further strengthens the Medicare drug pricing negotiation framework. It expands the number of drugs that can be subject to price negotiation between Medicare and pharmaceutical manufacturers, and it accelerates the timeline for bringing negotiated prices into effect. For seniors on fixed incomes managing multiple chronic conditions, and that describes the majority of people over 65 in this country, the cost of medications can easily consume a quarter or more of their monthly income. Any meaningful reduction in those costs is not just a financial relief, it's a health outcome. Because when people can't afford their medications, they skip doses. And skipping doses leads to hospitalizations. And hospitalizations are devastating, financially, physically, and emotionally, for elderly individuals and their families. There's also a provision in the Elder Care Bill that directly addresses what's called the Medicare Part D coverage gap, sometimes referred to historically as the donut hole. While previous legislation made progress in closing that gap, the new bill goes further by capping what seniors pay out of pocket for their Part D prescription drug coverage at a lower annual threshold. Once you hit that cap in a given year, your covered medications cost you nothing for the rest of that year. For seniors managing expensive conditions, cancer treatments, advanced diabetes management, rheumatoid arthritis, this cap is potentially worth thousands of dollars annually. Now, I want to take a moment and talk about something that doesn't get nearly enough attention in these conversations, and that's elder financial protection. Because the financial exploitation of seniors is an epidemic in this country, and the Elder Care Bill actually includes a dedicated section addressing it. New funding is being allocated to the Elder Justice Initiative, which supports adult protective services programs across the country, and funds a network of legal aid organizations specifically focused on elder abuse and financial fraud. The bill also creates new requirements for financial institutions, banks, investment firms, insurance companies, to have protocols in place for detecting and reporting suspected financial exploitation of older customers. This might not seem like a benefits change, but it is absolutely a protection that will save seniors money and preserve their dignity. Financial exploitation costs seniors in America an estimated $28 billion every single year. Every year. That money doesn't just disappear. It comes out of retirement savings, home equity, and the resources that were supposed to support people through their final years. I also want to address something that I know a lot of you are thinking about, and that's the question of how this is all being paid for. Because nothing in Washington is free, and the way a bill is funded matters just as much as what it promises. The Elder Care Bill's funding mechanism is a combination of several approaches. A portion comes from the expanded Medicare drug price negotiation savings. When the government negotiates lower drug prices, it saves money on the Medicare side, and those savings are being redirected toward the expanded care benefits. Another portion comes from adjustments to the Medicare tax on higher income earners. Individuals making over $400,000 annually will see a modest increase in their Medicare contribution rate. And a third funding stream comes from new caps on certain Medicare Advantage plan administrative costs, redirecting money that was going to insurance company overhead back into direct care. Is this funding structure perfect? Honestly, no. And there are legitimate debates among economists and policy analysts about whether these mechanisms will fully cover the long-term cost of these expanded benefits. But the Congressional Budget Office has scored the bill and determined that it is deficit neutral over the 10-year budget window, meaning it doesn't add to the national debt on paper. Whether you take that analysis at full face value or view it with some skepticism, it's worth noting that this bill went through more fiscal scrutiny than most, and that's at least partially why it managed to pass with bipartisan support in the Senate. Let's also talk about the timeline, because I know many of you are asking, when does this actually take effect? The answer is, it depends on which provision you're looking at. The Social Security Elder Equity Adjustment for those 70 and older is expected to begin being phased in within 12 months of the bill being signed into law. So realistically, if the president signs it in the coming weeks, you could see those changes reflected in your benefit checks sometime within the next year, though the full rollout may take slightly longer for the SSA to process. The Medicare Home Health Aid expansion has a slightly longer implementation window. The current estimate is 18 to 24 months for the full expansion to be operational nationwide. That's not because lawmakers want to delay the benefits. It's because expanding access to in-home care at this scale requires the healthcare infrastructure to scale up alongside it. More trained and certified home health aides, updated billing and coding systems, and state-level coordination. The Medicaid provisions, as I mentioned, are contingent on state decisions to opt in, and that process will likely unfold over the next 2 to 3 years, with early adopting states potentially seeing changes sooner. The prescription drug changes and the Part D cap adjustments are on a faster track. Some of those provisions could take effect within 6 to 9 months of the bill's signing. So what should you do right now? Practically, concretely, today? The first thing is to not wait for the changes to come to you. The Social Security Administration, Medicare, and your state's Medicaid office will be updating their systems and communications over the coming months. But the people who benefit the most from changes like this are the ones who proactively reach out, ask questions, and make sure they understand where they stand. If you're over 65, or if you have a parent or family member who is, call your local Social Security office and ask specifically about the Elder Equity Adjustment and when it will apply to your situation. Contact your Medicare plan and ask how the home health aid expansion will work for your current coverage. If you're a caregiver, or if you're navigating Medicaid planning for a loved one, reach out to your state's Medicaid office or a licensed elder law attorney who can help you understand the new protections and what they mean for your specific circumstances. The second thing I want you to do is share this information. Genuinely. I know that sounds like a typical YouTube thing to say, but I mean it sincerely. The people who are most affected by bills like this are often the least likely to have seen a video like this one, because they're not on YouTube. They're at home, managing health issues, handling family responsibilities, doing the best they can. But their children are on YouTube. Their neighbors are. Their community members are. If this video helped you understand something that you didn't understand before, pass it along. Because knowledge is the difference between someone getting the benefits they're entitled to and someone leaving money and protection on the table simply because they didn't know it was available to them. And the third thing, and this is especially for those of you who are still years away from retirement, is to let this moment recalibrate how seriously you're thinking about elder care planning in your own life. Because the dirty secret of all these legislative changes is that government programs, however well-intentioned, are never going to be enough on their own. This bill is a meaningful step forward. It will genuinely help millions of people. But it is not a complete solution to the elder care crisis. Long-term care insurance. Conversations with aging parents about their wishes and financial situation. Estate planning. And honest family discussions about caregiving responsibilities. These remain as important as ever. The government is doing more. You should be doing more alongside it. We are living through a demographic shift that is unprecedented in American history. The baby boom generation, the largest generation in American history, is now in its 70s and 80s. The strain on elder care systems is going to intensify significantly over the next decade before it begins to ease. Bills like this one are critical, and we should applaud the lawmakers on both sides who worked to make it happen. But the conversation can't stop here. It has to continue. In our homes, in our communities, and yes, right here, where people are actually paying attention and actually trying to understand what's happening. Thank you so much for staying with me through this entire breakdown. I know it was a lot of information, but every piece of it matters. And you came here because you wanted to understand, not just hear a headline. That tells me everything I need to know about this community, and I'm genuinely grateful for it. If there are specific aspects of this bill you want me to go deeper on, the Medicaid spousal protection rules, the prescription drug negotiation details, the elder financial protection provisions, drop it in the comments, and I will make sure we cover it. Your questions shape what we do next. Until then, take care of yourself, take care of your family, and I'll see you in the next one.